Welcome back, students. Shelley here. We are on section 2 of Alzheimer's disease. We'll start with the definition of Alzheimer's. Alzheimer's is a progressive, degenerative, and incurable disease, which means that it gets worse over time and has no cure, which is really sad. Alzheimer's slowly destroys memory and thinking skills. Most are eventually completely unable to care for themselves. Some facts about Alzheimer's is a family history of Alzheimer's disease increases the risk of a person developing the disease. Plaques and tangles build up in and around the nerve cells in the brain. Most are age 65 or older, and 2/3 of those diagnosed with Alzheimer's are women. It was named after a German physician, Alois Alzheimer, in 1906. Autopsy done on the brain of a female patient who died from unusual mental illness, and that's when they first found the plaques and the tangles were present in the brain. Some of the changes that happen in the brain of somebody with Alzheimer's disease, damage to the brain may begin as early as 10 to 20 years before the problem is evident. They will see plaques and tangles, which are only seen on autopsy. Begins in the hippocampus of the brain, an area important in learning and memory, and then it slowly spreads to other areas of the brain. As nerve cells die, the brain shrinks. So this is what normal nerve cells look like. And somebody with plaques and tangles, their brain will look like that. A healthy brain and an advanced Alzheimer brain, it literally is shrinking. This is a video I'll put on there so you can watch later. Signs and symptoms of Alzheimer's disease. The initial symptoms of Alzheimer's disease are memory loss and personality changes. Stages, I'm supposed to say mild Alzheimer's, or early stages. You will have some memory loss, forgetting some words, problems with concentration, but still probably able to be independent and able to work and drive. Moderate Alzheimer's, which is the middle stage, and this is the stage that lasts the longest. Forget recent events, forget some of your own past experiences, change in personality and behavior, moody or withdrawn, need help with ADLs such as elimination and choosing clothing appropriately, maybe changes to sleep patterns, increasing wandering, suspiciousness or delusions, confusion about time and place. Severe Alzheimer's or late stages this is the end stages where they are unable to communicate, unable to control movement, unable to respond to surroundings, and may affect their ability to walk, sit, and swallow, and they need significant help with their ADLs, including eating and elimination. Keep in mind that an AD patient may not have all the symptoms in each stage. They may have some symptoms from each stage and may advance quickly or slowly through the stages. They may exhibit symptoms from all 3 stages at the same time. There's another good book video to watch. The 5 basic needs of people with dementia: they need to be useful, they still need to be able to care for others and self, need to have self-esteem boosted, and they need to give and receive love, and they need to experience joy and laughter. All behaviors associated with AD should be viewed as attempts at communication related to unmet needs. So some of the behaviors with AD and dementia, pacing, that would be somebody that just walks back and forth in the same area. Wandering, they may wander away and not find their way back. Their judgment could be poor. They cannot tell whether it's safe or dangerous, usually not dressed for the right weather. Maybe looking for something. There are some safe return programs. Most nursing homes, the alarms go off if anybody tries to go out the doors. Common causes of pacing and wandering: restlessness, hunger, disorientation, need to use the bathroom, need their depend changed, constipation, pain, forgetting how or where to sit down, too much daytime napping, and the need for exercise. And I have seen that where they forget how to sit down and they're just pacing and pacing and pacing, and you sit them down, they're like, oh, thank you. Elopement is another word you need to learn. It's leaving the protected area. So when somebody gets admitted to a nursing home, they will do an elopement assessment, and they feel like that is somebody that would is a risk for leaving the facility when they're not supposed to. Behaviors with AD and dementia: sundowner syndrome, if you've heard of that. It's increased confusion at dusk or late afternoon, evening, or night. It may be caused by hunger, fatigue, a change in routine or caregiver, or being afraid of the dark. Hallucinations are seeing, hearing, smelling, tasting, or feeling things that are not there, sometimes caused by impaired vision or hearing. Behavior delusions are false beliefs, believes things that are not true. Catastrophic reaction is an extreme response. The person reacts as if there has been a disaster or a tragedy. It could be caused from fatigue, changes, overstimulation, difficulty with tasks, pain, or discomfort. Suspicion: patients with Alzheimer's or dementia may become more suspicious as their disease progresses. They may accuse staff or family of lying to them or stealing from them. Nurses' aides should never argue with them. Just offer reassurance, be supportive and understanding. Agitation: a resident who is excited, restless, or troubled is said to be agitated. They may pace, hit, or yell. Some common triggers are feeling insecure or frustrated, too much or too little stimuli, encountering new people or places, a change in routine, unable to distinguish fiction from reality. Sometimes that comes from watching a scary show or something on TV. Pain or discomfort, hunger, need to urinate, or have a bowel movement. Violence: resident attacks, hits, or threatens someone or self, may be triggered by frustration, overstimulation, change in routine, environment, or caregiver. If violence occurs, the nurse aide should notify the nurse, never hit back, step out of reach, stay calm, and remove any triggers. Inappropriate sexual behavior: the person cannot control behavior. It may mistake someone else for their partner, may be a sign of infection, poor hygiene, or incontinence. Inappropriate social behavior is cursing, name-calling, yelling, and do not take it personally. Look for the cause of the behavior: pain, need to urinate, stress, or noise. Rummaging and hoarding: rummaging is going through the drawers and closets that belong to self or others. Hoarding would be collecting and putting items away in a special place. Pillaging is actually taking the items. And then common in AD to wander and collect things, then leave in other places. Repetitive behaviors: they can either repeat phrases or they can repeat motions. So repeating the motions would include like clapping or tapping their fingers. Perseveration is when they repeat the word, phrases, or questions over and over again. Both of these things are, as long as they are harmless, they are allowed. Nurse aide should answer question each time it is asked with the same answer. So I know we had residents before that would ask the same question over and over again, and you just keep answering the question with your same answer. Currently, Alzheimer's disease has no cure. Symptoms worsen over many years. Usually takes 8 to 10 years to play out, unless they have other underlying conditions. The rate varies from person to person. Autopsy is the only way to absolutely diagnose Alzheimer's. It's the only time they're actually going to see the plaques and tangles. In the end stages of Alzheimer's, comfort, safety, good skin care, and good alignment are important. They may have other problems and injuries. Observe closely and report any changes. Infection is a risk from poor hygiene. Inactivity and immobility can cause pneumonia and pressure ulcers. That's that one.